So today we are going to talk about the anatomy of the diaphragm. So the diaphragm separates thoracic and abdominal cavity. It's composed of peripheral muscular portion which insert into the central part of the diaphragm or the central tendon, and the muscular parts has three components which is found peripherally. The first one is the vertebral part, which comprising the crura and the arcuate. So this is the muscular part of the diaphragm attached to the vertebra. Here we have two attachments by the crura and the arcuate ligament. Here we can see this is the right cross and this is the left cross of the diaphragm. So by these two cross crura, the diaphragm is attached to the vertebral body. You see here, this is the central tendon of the diaphragm, and here this is the right dome and this is the left dome of the diaphragm. Here is cable opening, this is the esophageal opening, and here this is the aortic opening of the diaphragm. So the right cross arises from the front of the L1 to L3 vertebral body and intervertebral disc. Some fiber of the right cross pass around lower esophagus. The left cross originate from L1 and L2 only. So the right crura is a little bit lower than the left one. The left only to L2, but here up to L3, as you can see in the picture. So here this is the right crura, go L1, L2 and L3, whether the left only L1 and L2. So the medial arcuate ligament, it's made of thickened deep fascia which overlie the psoas major, attached medially to L1, laterally to the transverse process of L1. So we have, this is the medial arcuate ligament. You see this is a psoas muscle. This is the medial arcuate ligament at the level attached here to the L1 medially, and the transverse process of L1 laterally. The lateral arcuate ligament made up of fascia which overlie the quadratus lumborum muscle and medially attached to the transverse process of L1, laterally attached to the 12 ribs. So the lateral arcuate ligament is here. This is the lateral arcuate ligament, medially attached to the transverse process of L1 and laterally attached to the 12 rib. You can see here. So the median arcuate ligament is a fibrous arch which connect the right and left crura. The median arcuate ligament is the fibrous arch that connect the right and left crura. So this is the median arcuate arch. So the other part, as we mentioned, the first part is the vertebral part of the diaphragm, and the second part is the costal, and the third one is the sternal part. So the costal, which attach it to the inner aspect of the lower 6 ribs, and the sternal attach it to the small slip arising from deep surface of the xiphoid process. So this is the anterior attachment of the diaphragm. So diaphragm is attached more proximal anterior and posterior attached distally, and this is why it have the shape of inverted J when we describing the diaphragm. So you can remember this shape, inverted J shape, when we describe, because anterior it's attached higher up into the sternum and the costal part here to the lower 6 ribs, and posteriorly attached to the level of L1, L2 up to L3 for right crura. So this is the inverted J shape. Okay, here this is the sternum, and here this is the vertebral body. So this is the inverted J shape when we talk about the diaphragm. Opening of the diaphragm. Opening of the diaphragm, here we have opening of the inferior vena cava at the level of T8, which transmit the inferior vena cava and the right phrenic nerve. We have a esophageal opening at level of T10, transmit esophagus, vagus, and branch of the left gastric artery and vein. And we have the aortic opening at the level of T12, transmit aorta, thoracic duct, and azygos vein. So 3 opening each at different level. Inferior vena cava or caval opening at level of T8, esophageal opening at level of T10, aortic opening at level of T12. So, and we should know each structure passing through each opening on the diaphragm. The left phrenic nerve into the diaphragm as a solitary structure. So the left phrenic piercing the diaphragm, not passing through one of these openings. So we have other opening in the diaphragm. We had opening for greater and lesser and lowest splanchnic nerve, which pierces the crura. We have opening for the sympathetic trunk as it passes posterior to the medial arcuate ligament. On each side we had superior epigastric vessels passes between the sternal and costal origin of the diaphragm. On each side we have also the left phrenic nerve, which piercing the left dome to supply the peritoneum and undersurface, and the neurovascular bundle of 7th to 11th intercostal space between the muscular slip of the costal origin of the diaphragm to the anterior abdominal wall. So all of this structure piercing the diaphragm. Again, here this is the diaphragm. As you can see, this is the right crura, L1, 2, 3. This is the left one, just L1 and L2. Here we have the median arcuate, medial arcuate, and lateral arcuate. A median connecting the two crura, a medial connecting a lumbar to the transverse process, a lateral from the transverse process to the 12th rib. So the shape of the diaphragm, as seen from the front, the diaphragm curve up into right and left dome. The right dome reach upper border of 5th ribs. The left dome reach the lower border of the 5th rib. So both of them reaching the 5th rib, but right upper border and the left into the lower border. The central tendon lies at the level of the sternal junction. The dome supports the right and left lung, and the central tendon supports the heart. As seen from lateral side, diaphragm is J-shaped, and it is long limb on vertebral column and short extending forward towards the xiphoid process. The level of the diaphragm. The levels of the diaphragm varies with the pace of respiration, the posture, and the degree of distension of the abdominal viscera. So the diaphragm moving with respiration, and this is why the level change. And with respiration, with posture, also when the patient is sitting or standing, and supine, when he is lying supine, is higher. So when the patient is sitting or standing, the diaphragm go down. When the patient lie flat, it go higher. Even the distension of the abdominal viscera higher after a large meal. So the action of the diaphragm is contraction that's pull down its center tendon and increase the vertical diameter of the thorax. So the motor supply is from the phrenic, which came from the C3, C4, C5 nerve root. The sensory innervation of the diaphragm by the parietal pleura and the peritoneum that covering the central tendon of the diaphragm is from the phrenic nerve. The periphery of the diaphragm is from the lower 6 intercostal nerves. Thank you.